Hello, ICU and ER nurses. First, thank you very much for your service to our community. I hope the donation of the masks and respirators is of great use to you. When I heard that you were reusing an N95 mask for an entire week, I knew that there were better solutions out there. So we'll go over a little bit of the equipment that I provided you. So starting first, almost all of you have this respirator. So the format that I'm going to follow is how to put on the respirator, how to do a check to make sure that you have negative and positive pressure, and we'll go over cleaning solutions, and then finally talk about some strategies that you could use when you're working for either a quick clean or a more deep cleaning. Okay, so first, there are two different types of filters that I provided to you. The first one that I provided mostly was these Honeywell P100s and then 3M P100s. Both of those are capable of achieving a perfect fit with this mask. So first, the P100 filter, what it's going to do is it's going to filter 99.9% of particulates down to 0.3 microns. That contrasts with N95, which is 95%. So I think that these are going to actually be superior for you, even though that these are not particularly rated for the healthcare industry. So first, with these ones, you want to pay a little bit attention because these are not manufactured, but they do fit. You're going to want to push in and then turn rather forcefully until you feel it lock. Once you feel that kind of tightness, what I want you to do is actually give it a hit. And if it's not fully in, which sometimes you can be under a false sense of security, it will actually pop off. Like that. So when you do it, you want to make sure that the fit is very nice, and then turn it just to the right point where you're feeling that kind of tension. Give it a couple of taps, kind of make sure it's good to go. So in case a patient or you accidentally hit it when you're treating somebody at a critical moment, that it doesn't pop off. That's the only disadvantage to these, is paying extra attention to make sure that they're not going to come off. Now, these are actual manufacturer and they have a better fit. But the reason that I think these are a little bit better is they have a plastic cover over the top of the actual filter. And what they'll allow you to do is you're able to do some basic sanitation over that, where this cannot get wet at all. So you need to keep this completely dry, just more or less the same as you would treat your N95 mask. So once that's on, what you're going to do to ensure a proper fit, untangling everything, is make it as loose as possible before doing anything. You're going to make sure that your hair is tied back, because unlike the regular mask that you're used to, a little bit of the seal will catch a tiny bit of the hair, and you need to get all that hair out of the way to ensure a proper fit. So anyways, what you're going to do is bring it over your head, making sure this is centered in the back of your head, and then you're going to pull simultaneously the bottom straps first. Pull them all the way tight. And then finally, reaching on top of your head, once you find it, you're going to grab the top ones and then give those a snug. Now to check your fit, what you're going to do is you have to do a negative and a positive pressure test. For the first one, the exhale one, you're going to use your hand to cover up your exhale, and then you're going to puff outwards. You're just going to breathe out. And you can feel the seal. If it's a good seal, you'll feel it all the way around. The second one is to completely cover the intake. And you're going to try and take a breath in. If you can't take a breath in, then you have a good seal. So that's another way to double check that everything is very good. So just let me demonstrate this. I wanted to say it because you won't be able to hear me clearly when I do it. So here we go. Now for the negative and positive pressure check. When breathing in, when it's all right, you'll feel like you're suffocating. It's a pretty horrible experience, but that's how you know you're safe. Now, let's talk about a little bit of the management. When you need to take it off, and it's completely dirty, you're covered in everything, saliva, blood, all that good stuff. So remove the mask, I would suggest, with your gloves on. And then if you're needing to clean the mask, with the gloves on, I would recommend removing the filters, setting them aside. Probably best to put it on a disposable type surface, potentially a Ziploc bag if you're looking for more permanent storage for that. And making sure not to have any like sort of crazy movements that might kick up particulate matter, which is unlikely, but it's just best to kind of undo this nice and slow, treat it with care, and put it there, because that is more or less your entire safety. So one advantage I think that's quite important to mention is that you're going to be able to reuse this for a pretty long period of time. It's not touching your face, it's touching the mask. And that's a huge advantage over reusing a disposable N95 mask, which is going to be contaminated. Then you're putting the contaminated surface right up to the seal point around your face where you don't have that. So anyways, taking these, carefully putting them aside. Now, I'm going to want to remove this front plate when we're looking for a deep cleaning. Now, you might not want to do a deep cleaning in between each patient. You conceivably could if you set up the proper workflow to do that. But I would imagine most of you would do a deep cleaning at the end of your shift, or if you're passing on your respirator to somebody else, which it is possible. If you wanted to do, I will give you the equipment to be able to do this, where you can actually share this and you can completely sanitize it, and then each nurse could have their own filters that they call their own. So you're going to want to remove the faceplate, as I was saying. There's a little lip right underneath the bottom here, and pull from the chin, basically. Be careful not to crack this piece, because this directs your flow of air downwards and not into your patient. And if you crack this piece, then this is going to be exposed. So it's just a piece of plastic, so just be careful. Now, this will allow access for both inspection and for cleaning of this area. This is probably going to get very dirty after a 12-hour shift. You can, additionally, if you want to, remove this inner insert, the same as your N95 mask. You can remove that. It's probably not necessary, but you can get a little bit more detail in the cleaning. Now, let's talk about the actual cleaning. You're going to need essentially 3 phases of the cleaning, and this comes from all of this information, as much as possible, is coming from the manufacturer's suggestion. So first, you're going to want basically a detergent where it's just warm water, no warmer than 120 degrees. This mask cannot get hotter than 120 degrees. So don't stick it in your dishwasher thinking that you'll sanitize it. So just lukewarm water or just water with some detergent. Now there's some substance that these particular masks cannot take. I will put that on the bottom now. I have no idea what it is, and neither do you. So whatever you're using, just Google it and make sure that it doesn't have that substance in it, per the manufacturer. Now, you're going to submerge this, and just with a soft cloth, sponge, brush, you're going to remove, like, it's the same idea as washing your hands. You need to actually physically remove all of the probably snot that's going to be in there from your 12-hour shift, making sure that you kind of get the inside lips of all of this clean, just getting all the physical debris underneath all of these flaps. There's one here on either side, there's on your nose, all that stuff that protects you and your patients from the outside world. Give that a nice clean and a scrub. Then when you're done with that, it's time for the next sanitation phase. I didn't have 3 buckets handy, but I would actually recommend having something like this set up at your work. Then you can put it into the sanitation. And it's okay to use bleach per the manufacturer's suggestions. And what they recommend is 30 milliliters of bleach for every 2 gallons of water. So probably 30 milliliters, because you're probably looking at a 2 to 3 gallon bucket. So probably somewhere around 30 milliliters, 40 milliliters. You put it in there, you let it sit. The manufacturer did not specify an actual set time for that, but with most cleaning solutions, it's going to be 10 minutes. You might not want to do the full 10 minutes. It's probably not needed, but nothing can survive 10 minutes in bleach that we know of in the scientific community. Then, that's living or dead, if you want to count viruses as dead. It will kill anything that you can throw at it that we're aware of as humanity. Then finally, you need to go to a rinse phase. So if you have any type of hose, any type of anything that can rinse it, a bucket to rinse, just making sure that bleach concentration doesn't get too high. And then the manufacturer recommends air drying. So you might not have the time to air dry, but you can have some paper towels or clean towels handy, and it doesn't take too long. You probably want to circle it a whole bunch of times. This is where being a musician and a music teacher in my former life before I was a Jiu-Jitsu instructor comes in handy. We have like French horns and the spit gets stuck and you need to turn it a whole bunch of times to get most of that out of there. This is the other part that I mentioned could come out. And then it might actually be a benefit if you're actually doing a full dry to take that out, because you might have a little bit easier access to actually get in here and dry. So I don't know if you want to do a deep cleaning in between each patient. That seems mighty inconvenient and probably unnecessary, but you could if you wanted to. Just make sure you don't lose any of these seals as you're doing that. So probably about, I'd say 45 seconds for a dry. If there's a little water in there, it's not going to kill you. As long as the filters are not getting wet. Don't get your filters wet. Okay, so some suggestions for cleaning this. What you don't want to do is you don't want to take a spray and then spray into it, because that's going to get it wet. So maybe something like a Lysol wipe or something similar where you can really control the amount of moisture getting into it, and just making sure you give it a light rub down and you're good to go. And then dispose of that. Okay. So let's talk about a potential strategy where you want to give like a reasonable cleaning, but you don't need a deep cleaning. Probably if you're just looking to clean the outside, just to sanitize that, I would remove the mask with the gloves, your dirty gloves. So you just got done with a patient. Remove the mask with the dirty gloves. Try not to touch anything. Then, at a distance, removing the filters that you have, setting those filters aside on a disposable surface. And then you could probably just give a quick spray of any type of cleaner, making sure, I'll have a note about the cleaner, wiping it down, and then you're done. Once it dries, then put it back up, and then you're good to go. That's probably the strategy that you'll use most often, but it's basically up to you in that area. So I hope that these tips were helpful. If I forgot anything, or if there's any suggestions, just some random person dropping by saying what I'm doing is completely wrong, then I'll maybe incorporate that and make a new and updated video based on the best available information. Just an asterisk at the end of this, I have no professional experience whatsoever. There is absolutely no reason that you should listen to me on any of this. I'm just reading manufacturer's specs and trying to give you the best information that I can have, so you don't need to go into data sheets and things like that to dig up this information yourself. I hope this helps. If you need anything, please just let me know and I'll have it delivered to you right away.